lower jaw is a single bone and is just a mobile bone in the skull, and it has a body and ramus, two ramus and body. This is the body and this is the ramus, left and right ramus. There is the angle between the ramus and body is called angle of mandible, and in the body you can see anterior surface of body, and at the midline there is a symphysis of Menti. Is remnant place for attaching of body in the mandible, because in embryological duration the mandible is separated and are pair bone, but is attached this location and forms the symphysis of Menti, and finally is a single bone. And in the body, there is a triangular structure or prominence. Is called mental protuberance. In the lateral portion, forms the mental tubercle. Is here. You can palpate the mental tubercle inferior to mandibular bone in the face, in your face. Please palpate this tubercle. And on the anterior surface of body, there is a mental foramen for passing the mental nerve, mental artery and vein. Termination branch of inferior alveolar vessels. Actually, the body of mandibular bone is divided to base and alveolar part. The superior border of the body is the alveolar part. The inferior border of the body is the base of mandible. And there is a line as an oblique line on the body. This is the oblique line. It's continuation of anterior border of the ramus in each side, and you can see oblique line in the body and ramus. This is the angle of mandible. It's located between the ramus and body. And you can see oblique line on the body is continuation of the anterior border of the ramus. The ramus has a foreborder, superior border, posterior border, inferior border, and anterior border. Anterior borders continuation of oblique line. Posterior border joined to the body and forms the angle of mandible. On the superior border, there are two processes, condylar and chronoid process. Condylar process is a rounded projection, but the chronoid process is a sharp and triangular process located anterior compared to condylar process. There is a mandibular notch between the chronoid and condylar process. And on the condylar process, you can see a head and neck. Actually, on the neck, there is a trigoid fovea. It's a depression for insertion of lateral trigoid muscles in infratemporal fossa. On the lateral surface of ramus is here. It's the placement for insertion of masseter muscles. And on the medial trigoid muscles inserted to ramus. You can see a condylar process and chronoid process and mandibular notch. Condylar process with the mandibular fossa from the temporal bone form the TM joint or temporomandibular joint. But in this slide, you can see internal surface of body and ramus. On the ramus, you can see a foramen as a mandibular foramen is covered with lingula at the anterior. Lingula is a thin bony projection cover the anterior wall of mandibular foramen. Inferior alveolar vessel and nerve passing is here for foramen, and you can see a mylohyoid groove and mylohyoid line. This is the mylohyoid line on the internal surface of body. Because of mylohyoid line on the internal surface of body, there are two hollow space or two depression. This is the submandibular, and this one is sublingual fossa for location of salivary glands, sublingual and submandibular glands. And finally, at the midline, there are four spines, two superior mental spine and two inferior mental spine. You know, this spine, superior and inferior mental spine, is attaching for geniohyoid and genioglossus muscles. And behind the third molar teeth, there is a groove for lingual nerve. It's very, very important. Please look at the video for mandible.
In looking at the jaws, we'll start, as always, with the bones. The word jaw is used in two ways. When we speak of jaws in the plural, we're referring to both the upper jaw, the maxilla, and the lower jaw, the mandible. When we say jaw in the singular, as in jaw movement or jaw bone, we're referring to the mandible. We'll take a good look at the mandible, the phonetic arch, enclosing the temporal fossa and the infratemporal fossa. Here's the joint surface of the temporomandibular joint, with the external auditory meatus and the styloid process just behind it. Here are the pterygoid plates, with the pterygoid fossa between them. This sharp projection, just medial to the temporomandibular joint, is the spine of the sphenoid bone. The part of the maxilla that bears the teeth is called the alveolar process. We'll look at the teeth later in this section. The alveolar process ends behind at the tuber. Now we'll bring the mandible into the picture. The mandible develops from two originally separate bones, one on each side, which fuse together here at the symphysis. The mandible is described as consisting of the body and the right and left ramus. The corner between the ramus and the body is the angle of the mandible. The rounded projection that articulates with the temporal bone is the condyle, or condylar process. The narrowing below the condyle is the neck. The sharp, slender projection in front of the condyle is the coronoid process, a major muscle attachment, as we'll see. The dip between the coronoid process and the condyle is the mandibular notch. The angle of the mandible is roughened on the outside and on the inside by the insertions of a matching pair of muscles, the medial pterygoid on the inside and the masseter on the outside, which we'll see shortly. The body of the mandible is described as consisting of the base and the alveolar process. The side of the body slopes upward and inward, slightly on the outer aspect, markedly on the inner aspect. The posterior part of the alveolar process bulges medially above this hollow, the submandibular fossa. This projection in the midline is the mental protuberance. On the inside, this roughened area is the mental spine. Two pairs of muscles are attached here, the geniohyoid and genioglossus muscles. On the inner aspect of the mandible, this thickening below the coronoid process is the buttress. In the middle of the ramus, level with the tops of the teeth, is the mandibular foramen. Just in front of it is a small upward projection, the lingula. The mandibular foramen is the start of a tunnel for the inferior alveolar nerve and blood vessels. A major branch of the nerve emerges on the outside at the mental foramen. In looking at the jaws,
Okay, this video is about mandible. Your class is finished. If you have a question, please ask the question, and I check the question in public chat. For 2 weeks later, because the next week I will explain about the other facial bones such as zygomatic, nasal cavity, orbital cavity, and 2 weeks later in the class you can present the a view of a skull, anterior view, inferior view, or other view, and you can present in the class and get the mark, help you to the final score in the head and neck.